Chapter 14, Neurodevelopmental Disorders. This is Barlow and Durand's textbook, Abnormal Psychology 7th edition. I'll be covering neurodevelopmental disorders. To begin with, neurodevelopmental disorders are developmental disorders that are based on neurological causes. There are attention deficit hyperactive disorder, which is known as ADHD, is a pattern of inattention, disorganization, forgetfulness, hyperactivity, and impulsivity. Copy number variance, CNV, is a mutation that creates extra copies of a gene on a chromosome, or it deletes certain genes. ADHD is affected by D4, D5, and DAT receptor genes. Specific learning disorders. Performance that is below an average person's age, IQ, or education. It is just unexpected underachievement for a child, let's say. Childhood onset fluency disorder, also known as stuttering, is when there's a disturbance in speech fluency, and this includes repeating syllables or words, prolonging certain sounds or pauses, and replacing words that are difficult to articulate. Language disorder is when there is limited speech in all situations, where expressed language is below receptive language. Reading disorder, also known as dyslexia. Reading disorders can manifest in three ways, as either dyslexia, fluency disorder, or comprehension disorder. Dyslexia is difficulty decoding single words. Fluency disorder is problems in reading words and sentences smoothly and automatically. Finally, comprehension disorders are difficulty getting meaning from what is read. Other than reading disorders, there are Tourette's disorder, is involuntary motor movements like twitching, vocalization, grunts, vocal tics, and they occur in rapid succession. Moving along, autism spectrum disorder. This is a neurodevelopmental disorder that affects perception and socialization with others. It includes childhood disintegrative disorder, autism, as well as Asperger's. Generally, individuals with autism have issues in joint attention, whereby when people look at something, the autistic individual would not follow a person's gaze. This also includes symptoms like restricted, repetitive patterns of behavior, interests or activities, as well as the maintenance of sameness, stereotyped ritualistic behavior. Individuals also have an unusual communication pattern. Treatment. Individuals with autism could be treated, or rather could reduce the symptoms of autism, as in the obvious or observable symptoms, by focusing on therapy that, let's say, enhances communication, as well as daily living skills, and also reducing problem behaviors, like reducing tantrums and self-injury. Savant skills. A third of autism spectrum disordered individuals have high attention and working memory. Severe ASD individuals, however, do not have savant skills. Rett disorder. This is a genetic condition that affects women diagnosed with ASD, with the qualifier associated with the mutation of a gene known as MECP2. Other similar disorders include social or pragmatic communication disorder. This is where there's a difficulty with the social aspects of verbal or non-verbal communication, like verbosity, prosody, excessive switching of topics, and dominating conversations. Individuals with this disorder don't easily learn the social rules. Prosody, when autism spectrum disorder individuals lack facial expressions and emotional intonation, so they appear monotone basically. Naturalistic teaching strategies. This is when individuals arrange the environment to spark interest of autism spectrum disordered individuals, and it is used as a teaching opportunity. It seems like naturalistic teaching strategies may or may not be inspired by Vygotsky's theories in regards to his zone of proximal learning, or something along the lines of that. Intellectual disability is a developmental disorder that is marked by significant below average intellect and adaptive functioning. or lack thereof. These individuals experience difficulty in daily living and have issues in conceptual, social, and practical issues. Phenylketonuria, PKU. This includes intellectual disability, seizures, and behavioral problems. It is due to phenylalanine, which is found in diet soda. Lesch-Nyhan syndrome. This syndrome can bring about an X-linked disorder as well as intellectual disability and cerebral palsy, like spasticity, tightening of muscles, self-injurious behavior like finger or lip biting. Down syndrome, also known as trisomy 21. This is when there's an extra 21st chromosome, and as a result, individuals with Down syndrome have intellectual disability, folds in the corner of their eyes, a flat nose, small mouth with a flat roof, congenital heart malformations, and increased risk of dementia. Aminocentesis is a method that detects the presence of Down syndrome, but not the degree of intellectual disability. This procedure involves removing or testing fluid surrounding the amniotic sac that surrounds the fetus, basically amniotic fluid. Chronic villus sampling, CVS, are when small pieces of placenta tissue is tested and removed to detect Down syndrome. So this is another method to test this disorder. Fragile X syndrome is the severe learning disorder in men, and it's caused by a disordered chromosome, which causes, as a result, intellectual disability. And it's to do with the abnormal X chromosome, where the tips look as if they're hanging by a thread. Women don't have this disorder because they have an extra X chromosome, which could correct the mistakes of a faulty X chromosome. That's because men have XY as their sex chromosomes, while women have only XX. Cultural-Familial intellectual disability. These include cultural influences that contribute to intellectual disability like neglect, social deprivation, and abuse. There's no biological treatment for intellectual disability. Individuals just need to be taught life skills. So in summary, we looked at neurodevelopmental disorders, we looked at attention deficit hyperactive disorder, ADHD, we looked at copy number variants, specific learning disorders, childhood onset fluency disorders like stuttering, language disorders, reading disorders that include dyslexia, fluency disorder, comprehension disorder, Tourette's disorder, autism spectrum disorder, treatment, savant skills, Rett disorder, social or pragmatic communication disorder, prosody, natural teaching strategies, intellectual disorder, phenylketonuria, PKU, Lesch-Nyhan syndrome, cerebral palsy, Down syndrome, aminocentesis, chronic villus sampling, fragile X syndrome, and finally cultural familial intellectual disability. Thanks for watching.